Hello everyone, welcome to Jessie's MedBio. In today's class, we are going to discuss about our second chapter, that is growth and development. Under this chapter, today I am going to explain about first three topics. So first one is definition part of growth and development, then second one is principles, and third one is factors affecting growth and development. So first one is the growth. Growth refers to an increase in size or mass of the tissues. It is largely attributed to the multiplication of cells and increase in intracellular substance. So, growth means what? It refers to the increase in the size of the tissues. And also, it refers to the multiplication of cells and the increase in the intracellular substances. And it can be measured in inches, centimeters, kilograms and pounds. So it is a quantitative term, which means growth is a measurable factor. So we can say it as a quantitative term, and also it can be measured in inches, centimeters, kilograms and pounds. So next one is the development. Development specifies the maturation of function or physiological maturation, which means development focuses on functional maturation and the physiological maturation. The term development is used to refer progressive increase in skills and capacity to function is qualitative change in child's functioning, and it is difficult to measure. Development means it is refers to the increase in the skills and capacity to function. So it is a qualitative term. We can't able to measure this. So growth means it is an increase in the size or mass of the tissue, and it is a quantitative term, while the development means it is the increase in the skills or capacity. So it is a qualitative term. That is about the growth and development. So second one is principles of growth and development. Under this, around 10 principles are coming. So the first one is development is similar for all children, which means all the children following the same sequence of development. One stage comes before the next. So for an example, a baby will stand before walking. A baby will draw a circle before drawing a square. So all the children following the same sequence. That is about the first principle. Then second one is development proceeds from general to specific, which means firstly a child will develop the general movement, then only he or she will develop the specific movement. Like a baby moves the whole body first, then only he or she will start to move their hands and fingers. Third one is development is continuous. Development begins at conception and continues throughout the life, which means the development starts to begin at the conception stage itself, and it will continue throughout the life of a child. Then it may be fast in some times and slow at others. For example, a child first goes and babbles, then speak words, and later he or she will start to say the sentences. That's why the principle is saying us development is continuous. Then fourth one is development occurs at different rates, which means growth is not equally fast at all ages, which means during the fetal life or infancy period and the puberty period, the growth is very rapid. But it will get slower during the school age, adulthood and the old age. That's why the principle is saying that development occurs at different rates. Then fifth one is growth and development are related. How means the physical, mental, emotional and social development influences each other, which means one will depend on another. For an example, as the body matures during the puberty, the thinking, interest and the behavior of a child will also get changed. Then sixth one is development depends on maturation and learning. Development occurs through maturation and learning. Maturation means it is the natural growth, And learning means it is the practice and experience. Through these two processes, the development is occurring. Both are necessary for the normal development of a child. For example, a child may have musical talent, but without the practice or without proper experience, the talent will not fully develop. That's why they are saying that the maturation and learning depends on each other. Then seventh one is there are individual differences, which means every child develop at their own pace. Like each child is differ in their height, weight, skills and abilities. For example, one child may walk at 10 months while another walks at 14 months only. Then eighth one is early development is more important, which means early life lays the foundation for future growth and development. The good nutrition, care and a healthy environment in pregnancy and infancy are very essential for the development of child, for the proper development of a child. Poor conditions can affect the later development. Then ninth one is development occurs in stages. We all know about the stages of development. They are saying that development is happening or occurring according to the stage wise only. So prenatal stage means from the conception to the birth. Then neonatal means from the birth to 4 weeks after the birth. Then infancy means 4 weeks to 1 year. Toddler means 1 to 3 year. Preschool means 3 to 6 year. School age means 6 to 12 year. And adolescent means from 13 to 18 years. Then last one is development follows predictable patterns. Development occurs in two directions. They are saying that development is following a predictable pattern. So we can able to see two predictable patterns. So first one is the cephalocaudal pattern and second one is the proximodistal pattern. So first one is cephalocaudal pattern. Cephalocaudal pattern means from head to toe, which means development starts from the head and moves towards the feet. Firstly, the development is starting from the head region and then it is moving towards the feet. For example, the baby controls the head before sitting, standing and walking. That's why they are saying that it starts from the head and continues towards the toe. Then second one is proximodistal pattern. So which means the development is from center to peripheral region. Which means development starts from the center of the body and move towards the hands and feet. Firstly, the development is begin from the center of our body. Then it will move towards our hands and to the feet. That's why they are saying that from the center to periphery. These are the two predictable patterns. Next I am going to explain about the factors which are affecting the growth and development. So here we can able to see mainly three factors. So first one is heredity or genetic factors. Second one is environmental factors and third one is other factors. The environmental factors is again divided into two, that is prenatal environment, which means before the birth, then postnatal environment, which means after the birth. Then under the other factors, the first one is socio-economic conditions, second one is cultural influences and third one is emotional factors. So first one is heredity. These are the characteristics a child inherits from the parents through genes. They determine the child growth potential, which means certain type of characteristics will get transmitted from the parents to the children. So certain type of characteristics are known as, or certain type of factors are known as genetic factors. So first one is the race. Different races have different growth patterns. For example, average height and body build vary among the population. Then sex. Sex is determined at the conception itself. Male babies are usually slightly heavier and longer than the female babies. During puberty, boys grow taller and heavier than girls. Then biological rhythm and maturation, which means growth follows a genetically programmed pattern. For example, girls attain menarche around the same age as their mothers. Then genetic disorders. Inherited diseases can affect the growth and development. So the genetic disorders are classified into two, that is chromosomal disorders and the gene mutation. Chromosomal disorders such as Down syndrome or Turner syndrome will affect or will cause the delay in growth and development. And also the gene mutation disorders like galactosemia and other metabolic disorders. These all will affect the proper growth and development. Then second one is the environmental factors. Environment influences whether a child's genetic potential is achieved. It is divided into prenatal environment and postnatal environment. So first one is the prenatal environment. Under that, first one is nutritional deficiency in mother, which means the poor maternal nutrition will cause poor fetal growth and it will also cause low birth weight in babies. Then second one is obstetric disorders like pregnancy-induced hypertension or preeclampsia or multiple pregnancy, malposition of fetus. These all will reduces the fetal growth. Then third one is maternal metabolic disorders, which means diseases such as diabetic mellitus may cause large baby, that is known as macrosomia, and also it will lead to some birth complications. Then maternal infections like rubella, syphilis, HIV or cytomegalovirus or toxoplasmosis, all these kinds of infection will cause congenital defects and poor fetal growth. Then drugs taken during pregnancy. If you are taking certain type of drugs, one example is thalidomide, such type of drugs will cause harm to the fetus. Then maternal hormones. If there is a deficiency in the thyroxine, it will lead to poor brain and skeletal development of the baby. And also if the mother is having high insulin level or maternal diabetes, it will lead to the large baby, that I already explained in previous. These are about the prenatal environmental factors. Then second one is postnatal environmental factors, which is occurring after the birth. So first one is nutrition. Proper nutrition is essential for normal growth. Poor nutrition causes protein energy malnutrition, anemia, vitamin D deficiency, overnutrition can cause obesity. Then second one is infection and infestation. Repeated infections like diarrhea, respiratory infection, worm infestation will slow the growth because all the nutrients will lost and appetite will get reduced. Then chemical agents. Exposure to chemicals or hormones can affect the skeletal growth of the child. Then trauma. Bone fractures can damage the growth plates. Then head injury may affect the brain development and their mental growth. These are the two type of environmental factors. Then third one is other factors. Under that, first one is socio-economic condition. Children from poor families may have poor nutrition, poor housing, lack of health care, poor sanitation. All these factors will cause delay in the growth and development of the child. Then second one is cultural influences. Culture affects feeding practices, child rearing practices and food habits. For example, avoiding nutritious food due to customs may cause malnutrition, which means we all are from different cultures. Each culture is having different practices. So some kinds of customs and beliefs will leads to delay in the growth and development of the child. Then emotional factors. A loving and secure environment promotes healthy growth. Negative emotions such as anxiety, fear, neglect, lack of parental love and living in orphanages, all these negative emotions will lead to the delay in growth and development of a child. These are the other factors. So in today's class, we discussed about the definition of growth and development, then the principles of growth and development, and third one is the factors affecting the growth and development. Under the factors, around 3 factors we learned. So first one is the hereditary factors, second one is environmental factors, under that prenatal and postnatal, and third one is other factors. Under that, socio-economic factors, cultural factors, and emotional factors.